Next, you'll need to choose between Blue Cross Blue Shield of Tennessee or Cigna. Our health insurance carriers administer the medical network options. Both carriers offer expansive networks of doctors, hospitals, and facilities. We've already gone over the plan options, so now it's time to pick a network. There are 4 networks available. If you choose Cigna, you can select Cigna's Local Plus or Open Access Plus. If you opt for Blue Cross Blue Shield, you can choose from Network S or Network P. Blue Cross Blue Shield's Network P and Cigna's Open Access Plus expanded networks do offer more providers and hospital options, but there is an additional cost added to the monthly premium. You may also pay more per claim because the costs for services in these networks are generally higher. Before making a decision, we recommend checking hospital and provider participation in the various networks. Do the same for any provider you want to continue seeing. You can find the hospital list and search for providers on the Partners for Health website by hovering over the Health Options tab and clicking on Carrier Information. Once you enroll in a network, you cannot switch to a different network, even if your provider leaves mid-year. You will only be able to make changes during the next annual enrollment or after a qualifying event. It's important to evaluate your total healthcare costs and usage for each plan, as your needs may change. Regarding plans, the main differences between the PPO auction and the CDHP HSA plan are in the costs, the premiums, copays, deductible, and coinsurance. The services and network providers will remain the same. You need to decide between your monthly costs and what you might pay if and when you use your benefits. When it comes to the carriers, Blue Cross, Blue Shield, or Cigna, there are small differences in their medical policies. However, your costs and benefits will be the same no matter which one you choose. Lastly, when examining the networks, all of them offer a wide variety of providers. In fact, when comparing these networks, the efficient networks include more than 95% of the providers and 85% of the hospitals that are in the expanded networks. You do not need to enroll in expanded networks for coverage outside the state, because you will have the access to the National Blue Card Network and Cigna's Open Access Plus network. Remember to begin your provider search with the efficient networks first. Let's look at more about networks and plans.